everyone, good evening. I am Chilin B. Fernandez, and this night I will discuss about the occupational health and safety. So, before we proceed with the topic, let us know first the objectives. First is to define occupational health, and second is to discuss challenges for the development of occupational health and safety. Health and safety is one of the most important aspects of human concern. It aims an adaptation of working environment to workers for the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. The question of occupational health and safety as a global issue is now taking a new turn. The main contributory factors towards this idiosyncrasy seem to be due to the rapid industrial and agricultural development that are taking place in the developing countries and the emergence of new products and product processes from these places. Many of these countries are moving from manual labor to service mechanization in the main productive sectors such as manufacturing, mining, and agriculture. Hence, the potential occupational health ramifications should also be anticipated. Also, the insatiable desire of these countries for technical advancement has brought about the importation of sophisticated machinery and pieces of equipment not only into the industrial production sector but also to the services and commerce. This invariably has been associated with a change in the structure of the labor force as a whole, including a rise in the employment of women. As to be expected, the health problems would also change. For example, the emphasis on ergonomics and occupational psychosocial factors would be a new challenge for occupational health and safety practice in most African countries because the tool to deal with such problems and expertise is not yet advanced when compared to the developed countries.
Tonight, I will be continuing the discussion of Ms. Fernandez. Occupational health and safety programs offer numerous benefits to both employers and workers. By prioritizing the health and safety of workers, employers can prevent accident, improve productivity, comply with legal requirements, and enhance their reputation. Additionally, workers benefit from a safe and healthy work environment, leading to improved well-being and job satisfaction. Benefits of an occupational health and safety management system are: first, improve health and safety performance. There's absolutely no doubt that adopting a systematic approach of health and safety management and using a specific system will make managing your business easier. Second, reduce costs associated with accident and incident. Third, improve staff relations and morale. Fourth, improve business efficiency. Is one of the best way to improve the efficiency of your business because it reduces your costs almost across the board. Fifth, improve public image. And sixth, lower insurance premium. When most business start considering a formal health and safety, one of their first consideration is cost. While cost is certainly part of the equation, it is important to understand how the outlay is offset by cost savings. 7. Easier access to finance. 8. Increase regulatory compliance. 9. Improve confidence. Last but not least, boost corporate and social responsibility. As a business or organization, these 10 amazing benefits of adopting a health and safety management system should be irresistible. Focusing on employee health and safety can have major ramifications for your business and can impact everything from your profit to your cost and even your public image. Additionally, the benefit of occupational health service in developing countries is seen locally as well as on a nation level. The positive impact of occupational health service locally may be observed in reducing morbidity and work-related injuries. In addition, this also means fewer losses to employer and worker. There will be a reduction of wage losses and decreased compensation costs. The reduction of absenteeism is a great importance concerning skilled labor, especially in countries where there is a shortage of skilled labor. Making working conditions healthy and safe is in the interest of workers, employers, and government as well as the public at large. Although it seems simple and obvious, this idea has not yet gained meaningfully universal recognition. Hundreds of millions of people throughout the world are employed today in conditions that breed ill health and unsafe. Each year, work-related injuries and diseases kill an estimated 2 million people worldwide. Annually, an estimated 160 million new cases of work-related diseases occur worldwide, including respiratory and cardiovascular disease, cancer, hearing loss, musculoskeletal and reproductive disorders, mental and neurological illness. An increasing number of workers in individual countries complain about physiological stress and overwork. These psychological factors have been found to be strongly associated with insomnia, depression and fatigue, and burnout syndrome, as well as with elevated risk of cardiovascular disease. Even in advanced economies, a large portion of work sites are not regularly inspected for occupational health and safety.
I'm going to discuss the definition of terms. According to WHO, 1995, occupational safety and health can be defined as a multidisciplinary activity aiming at so aminin sa WHO World Health Organization exposes those gaps and describe the efforts needed to bridge them. Protection and promotion of the health of workers by eliminating occupational factors in conditions hazardous to health and safety at work. Enhancement of physical, mental, and social well-being of workers and support for the development and maintenance of their working capacities as well as professional and social development at work. Development and promotion of sustainable work environments and work organization. The ILO or WHO definition of occupational health is the promotion and maintenance of the highest degree of physical, mental, social well-being of workers in all occupation. And the WHO consider occupational health service to be responsible for the total of worker and, if possible, his or her family. So the ILO Convention on Occupational Safety and Health 1981 defined health in relation to work as not merely the absence of decrease or infirmity. It also includes the physical, mental elements affecting health, the two that are directly related to safety and hygiene at work. Occupational health is a diverse science applied by occupational health professionals, engineers, environment health practitioners, chemists, toxicologists, doctors, nurses, safety professionals, and others who have an interest in the protection of the health of workers in the workplace.
Good evening, everyone. My name is Laika Maynulut, and tonight I will discuss health and safety. Workers' health and safety is all about sensibly managing risk to protect your workers and your business. Good health and safety management is characterized by strong leadership involving your managers, workers, suppliers, contractors, and customers. In a global context, health and safety is also an essential part of the movement towards a sustainable development. Interdisciplinary relationships, environmental. An interdisciplinary relationship defined as two or more disciplines collaborating to accomplish a common goal is considered a general and broad form of collaboration. Managers are those trying to eliminate hazards from the workplace cause many environmental problems. Toxicologist are person who study poisoning and responsible defining quantitatively the level of exposure at which harm occurs, and they also prescribe precautionary measures and exposure limitations so that normal recommended use of chemical substance does not result in excessive exposure and excrement harm.
Hello everyone, by the way, my name is Karen Joyce Baligwat and today I am going to tackle the key components. Number 1. The availability of occupational health and safety regulations at workplace. Number 2. The availability of active and functional occupational health and safety committee at workplace. Number 3. Monitoring and control of factory hazards to health. Number 4. The supervision and monitoring of hygiene and sanitary facilities for health and welfare of workers. Number 5. Inspection of health safety of protective devices. Number 6. Pre-employment, periodical and special health examination. Number 7. Performance of adaptation of work to man. Number 8. Provision of first aid. Number 9. Health education and safety training to the worker. Number 10. Advice to employers on the above mentioned items. Number 11. Reporting of occupational deaths, diseases, injuries, disabilities, hazards, and their related preventive measures at working. According to a statement by Occupational Health Institutes collaborating 1995, the most important challenges for occupational health for the future will be the occupational health problems linked to new information technologies and automation, new chemical substances and physical energies, health hazards associated with new biotechnologies, transfer of hazardous technologies, aging work populations, special problems of vulnerable and underserved groups, problems related to growing mobility of worker population, and occurrence of new occupational diseases of various origins.